Hi, I'm Amy Larocca. I'm a speech-language pathologist and an assistant professor at Baldwin Wallace University. I am certified in Speak Out and LSVT Loud speech therapy. These are both programs for people with Parkinson's. Today we're going to be talking about speech therapy and Parkinson's disease. So speech therapy can help improve and maintain speaking, thinking, and swallowing skills. So for speaking, we can help to maintain a good, loud voice that can be clearly heard, a good, clear voice, so it's not gravelly, as well as helping you to maintain enough breath support that you can be heard throughout the entirety of your sentence or your conversation. For thinking skills, we help you to maintain a good memory, problem solving, be able to think through and plan your day. And for swallowing, we can help to ensure that you are eating and drinking safely and comfortably, helping to reduce any coughing or throat clearing that you may experience during your meals. So what does speech therapy look like? It can take the form of many different things. You may think about it as being in a room with one other clinician and yourself, where you go through some different activities or education. That is one part of speech therapy, but the majority of speech therapy that we do with people along your entire journey with Parkinson's disease is we have more group opportunities to have conversations, to be able to utilize the skills that you learn in individual clinic, and you can transfer those into functional scenarios where you're having conversations with people. You're talking about various things, you're sharing a meal with them so that you can really implement the skills for eating and drinking and communication, all while socializing in a fun environment. Speech therapy can also look like a singing choir. You might not have thought about that before, but when we sing, we take a deep breath, so it works on your breath support. We help to really project our voice, and we stretch those vocal cords so that you can get to different pitches within your voice. That helps all of those muscles that you use to speak. It helps them to be able to work nice and effectively. So I told you I'm a professor. I'm going to have a pop quiz for you today. So you are back in class. First question for you, about how many muscles do you think that it takes to speak? 57, 26, 100, or stop it, it's Saturday, class is not in session right now. You are in class, you're learning lots of great things. So what do we think? There are actually 100 muscles that are involved in speaking. Fun fact, there's 26 sets of muscles that are involved with swallowing, along with 7 cranial nerves. So think about this, 26 sets of muscles for swallowing, 100 muscles for speaking. All of those muscles react just like your muscles for walking, standing, or sitting also react. I know you either heard or you're going to hear from occupational therapy and speech or in physical therapy, and they're going to talk about exercise and how effective exercise is to help maintain and improve your movement. The same theories are true when we're talking about speech and swallowing. You need to exercise often, start exercising as early in your journey with Parkinson's disease as you can to help maintain those skills. So when I'm talking about exercise, we're exercising your muscles in your throat, you're exercising your breath support to be able to have a nice loud voice, and you're exercising those muscles to swallow nice and strong to protect your airway and prevent that aspiration pneumonia. One more question, I think it is the last. So when should you talk to your neurologist about seeing a speech-language pathologist or speech therapist? We're the same profession, we're just called a couple of different names. So A, when I notice my voice getting quiet. B, when I notice that I'm coughing when I take my pills. C, when I notice that I'm forgetting where I left my wallet or purse. Or D, now. Take a second. What do you think? When should you ask your neurologist about seeing a speech-language pathologist? Now, of course. So we can help wherever you are along your journey with Parkinson's disease, we can help you. We can be part of that team that is able to help maintain or grow those skills and the strength that you have and you use every day. So let's talk about this a little bit further. So early in, if you're more recent within your diagnosis and you feel like you don't have any difficulty in the areas that I've talked about so far, coming in just for a consultation would be beneficial. We can help to provide some information, provide some education, and really give you some good tips or strategies, as well as some education as to when it might be a good idea to come in and maybe have what's next on our list, an assessment. When we do an assessment, whether it's for swallowing, cognition, or speech, we take a look at what skills do you have now. And we're able to use that for baseline for when you may incur difficulties or challenges along the way. We can look back at that baseline and compare to be able to see, is this how you were functioning before? Maybe it's not that much of a concern now, or is this a change that we need to then kind of move on and work on some compensatory strategies or therapeutic interventions? So those are next on our list. Compensatory strategies can help make your functioning a little bit easier, just some tips and tricks to make things easier for you. And then therapeutic intervention are going to focus on improving that coordination, improving your strength so that you don't have to use the compensatory strategies and just your natural movement or speech or swallowing is fine on their own. And then the majority of where kind of our role within your journey with Parkinson's is in that maintenance program. So, the same thing with rock steady boxing with these different groups, movement groups, dancing, choirs, they're helping you to maintain the skills that you already have. You may go for individual speech therapy from time to time just to boost your skills, but then you're going to practice those weekly in the various different groups that we have available. And any speech therapist, any kind of clinic that works with people with Parkinson's disease typically have groups, maintenance groups, these weekly groups that you can participate in for the rest of your, the rest of your life to be able to maintain these skills. If your speech therapist, if you already have a relationship with one, doesn't already have a group, ask them and they'll have a referral to somewhere who does have a group for you. And then the last thing that we do as speech language pathologists are these periodic reassessments. So there may be times where you notice that pills are getting stuck in your throat when they may not have before. We can take a look and do a reassessment to make sure that, to see how we can help you best at that time. So there's lots of different ways that we can be part of your team in this journey with Parkinson's disease. So specifically with speech therapy, we talked how singing is very important. We're going to talk about speech, cognition, and swallowing and our roles within that, some various different things. So singing, like I said, helps with breath support and that intentionality within your speech. There are two different types. Speak Out and Lee Silverman Voice Therapy are intensive speech programs that can help you to really develop that clear, nice, loud, intentional speech. Similar programs, but based on some different theory behind the two. Expiratory muscle strength training we'll talk about again in just a second, but it helps to improve your breath support. It's exercise for your lungs. A little bit later on within your journey with Parkinson's, you may notice that with your own muscles and your own ability to speak, it may not be loud enough for people to hear. So having a personal voice amplifier with a microphone and a speaker is beneficial to be able to have people to hear you. And then, later on in your journey, you may find that augmentative and alternative communication devices, AAC device, might be beneficial to help be able to communicate for you if you're not able to communicate for yourself. Swallow therapy, there's some different things we can do. Periodic evaluations are very important. So making sure that you're checking in with a professional to be able to make sure your swallowing is nice and safe. Again, that the respiratory muscle trainer, we can work on some more traditional speech therapy strengthening techniques, and then eating. Eating is the best exercise for swallowing. I'm not going to go through all of these different strategies, but for cognition, we really work on what are some tips and tricks to help you to be able to move easily through conversations, through your speech, through memory. And here are just a couple of tips for you. So final thoughts to take home, please be open to welcoming speech therapists to your team, no matter where you are in your journey for Parkinson's. Also, remember that muscles for swallowing and speech are similar to your muscles for walking. Exercise early and often. Exercise is medicine. And then find those fun ways to be able to utilize and maintain your skills for speech, cognition, and swallowing. Thank you so much for spending time with me today. I greatly appreciate it. If you have any questions, please feel free to reach out to me. And I can at either Larocca@bw.edu or the phone number on that page, and I'd be happy to help. Have a great day.